Hello and namaste. I'm Dr. Sudha Tandon, gynec endoscopic surgeon and IVF consultant, and I practice at Chembur in Mumbai and Navi Mumbai. Today, we are going to talk about a very important topic in gynecology, and that is about ectopic pregnancy. So, let us understand what is ectopic pregnancy. We all know that the pregnancy implants itself inside the uterine cavity. But if it doesn't, or it implants in other places other than the uterine cavity, it is called as an ectopic pregnancy. Most oftenly, it implants into the fallopian tube. It could be either the right or the left one. Why does it implant most commonly in the fallopian tube? Because the pregnancy, the fertilization of the egg and the sperm happens in the fallopian tube. It will not go further to reach the uterine cavity. It could just implant into the lumen of the tube and start growing over there. Other common sites is either it can implant into the ovaries or anywhere into the abdominal cavity. It could be the fat into the abdomen or into the part of the uterus where the cesarean section was done. So these are the common places where an ectopic pregnancy can start growing. Today we are going to talk mainly about tubal pregnancy, as that is the most commonly found ectopic pregnancy in women. Now it is seen that tubal pregnancy is found in 1 to 2% of the patients who get pregnant. What are the symptoms? Normally, a woman would miss her period. It could be either few days or even a month or more than that. And she could have some spotting per vagina, some little bit of bleeding off and on, and she could also have abdominal pain. Or she could have symptoms of irregular periods. It's also seen in women who use copper tea as their contraception. A tubal pregnancy is also commonly found in patients who are infertile and who are undergoing treatment for infertility. It could be either an IUI or IVF. It is also more commonly seen in women who have some sort of infection of the fallopian tube in the form of a past pelvic inflammatory disease, commonly seen in women who have undergone either a tubal sterilization or some surgery on the fallopian tube. So how does one come to know that the patient is suffering from a tubal pregnancy, and why is it important to know? Because a pregnancy in the fallopian tube cannot grow beyond a certain period of time. Maximum it could grow up to 2 months or 2.5 months. But most commonly, it will not go beyond few days after missing the period. The muscle of the tube is very thin and it will just give way, it will tear, and there can be torrential bleeding, and this is a risk to the woman. So which are the tests which are done to know that a woman has a tubal pregnancy? Now the most common test which is done in these women who miss their period is a pregnancy test. So if a woman has a pregnancy in the uterine cavity, the level of the beta HCG doubles in 48 hours. And this will not happen if the pregnancy is in the fallopian tube. The levels of beta HCG will be less than double in women with tubal pregnancy if it is repeated within 48 hours. Also, if a sonography is done, and if on a pelvic sonography which is done transvaginally, no pregnancy is seen in the uterine cavity, there could be a pregnancy which could be seen outside the uterine cavity, and that is where the diagnosis can be clinched. So, no pregnancy seen in the intrauterine cavity, and maybe a pregnancy seen outside the uterine cavity. So, this is a very important test to know whether a woman has got a tubal pregnancy. It could also be found that the woman doesn't complain of any symptoms, and in a routine way, because she has missed a period, her pregnancy test comes positive, we send her for a sonography and we find that she has a tubal pregnancy. So what are the ways to treat it? It all depends on the size of the tubal pregnancy. It all depends whether it has already ruptured and she has come in a state of emergency. If she has come in a state of emergency and there's a lot of bleeding in the peritoneal cavity, then she would definitely need an emergency operation. For the safety of the woman, she needs an emergency surgery, whether laparoscopy or by the open method. This will be a life-saving procedure for the woman. If the tubal pregnancy is detected early without it having ruptured, then we can plan the treatment. Now this treatment, if the sac in the fallopian tube is very small or if the beta HCG level is not very high, she can be given medical line of treatment in the form of injection methotrexate. Only thing is that she should be under observation by doing repeated beta HCG, and the beta HCG should come to zero in a matter of a month. In this 1 month, if she has any symptoms where there is bleeding inside the abdominal cavity, then she would need a emergency surgery. The other way of treatment is the surgical method of treatment. Now this surgical method of treatment can be done laparoscopically by having just 3 punctures on the abdominal wall, and she can go home in less than 24 hours. Which are the women that we offer laparoscopy treatment? Now if the pregnancy in the fallopian tube, the size is very big, or it's a live pregnancy, the beta HCG is very high, or she has abdominal pain, then probably we have to do a surgical treatment. Now during laparoscopy, depending on the condition of the fallopian tube, we may either salvage the tube by just making an incision on the fallopian tube, extracting the pregnancy and taking care of any bleeding from the incision on the fallopian tube. Most often we have to remove that fallopian tube, which is called as salpingectomy. So what about the fertility of a woman in whom one of the fallopian tubes has been removed because of an ectopic pregnancy? It all depends on the condition of the opposite fallopian tube. If it is in a good condition, if there is no blockage, or if there are no adhesions around the fallopian tube, then it will function normally and she has a good chance of conceiving an intrauterine pregnancy. But if the other fallopian tube is not good, it is blocked, or there are some adhesions around it, then she would probably need an IVF pregnancy for getting pregnant. Do press the like button if you have found this video useful, and follow us on Instagram and Facebook. Thanks for watching this video.